Hi friends, in this video I would like to discuss about some special views of X-ray. Coming to the special views, it includes axial view, which is very much useful in diagnosis of calcaneal fracture. Calcaneal fracture is also known as lover's fracture or thieves fracture. Axillary view, which can be useful in the diagnosis of dislocation of shoulder. Y view or transscapular view, very much effective in posterior dislocation of shoulder diagnosis. Scaphoid view, obviously for scaphoid fracture, and sacrum lateral view to diagnose coccyx fracture. Another view is patella skyline view. Shoulder, I already explained axillary and transscapular or Y view. Calcaneum axial view, scaphoid oblique view or scaphoid view. Mouth open dense for odontoid process, OM or occipitomental for skull, facial bones and sinus. This is scaphoid view, special view, which is taken in ulnar deviation to diagnose whether there is fracture of scaphoid. In fracture scaphoid, mainly there will be tenderness to anatomical snuff box. In such conditions, we are taking scaphoid view X-ray. But in initial view X-ray, there won't be any fracture, so that we are doing the immobilization in glass holding position and then check X-ray is taken on the 10th day. These are the fracture of scaphoid, in which this particular fracture through the waist or middle of scaphoid causes a vascular necrosis to the proximal fragment of scaphoid. This is sacrum lateral view to diagnose whether there is fracture or displacement to coccyx. We should not advise LS spine X-ray. For that, we are taking sacrum lateral view. This is AP MORTISE view, which is different from AP normal AP view angle. And in AP MORTISE view, we can check whether there is diastasis of distal end of tibia and fibula. And here you can see the clear space in normal AP MORTISE view. And in AP MORTISE view, a 30-degree internal rotation of the leg. In this particular position, AP MORTISE view is advised. This is the difference of normal AP angle and MORTISE view of angle joint. Here you can check whether there is diastasis of the distal end of tibia and fibula. Here this is normal AP view. And for posterior dislocation of shoulder joint, if you are taking normal AP view X-ray, here you can see there is internal rotation of the head of humerus. This particular feature is called as daylight sign. This is seen in AP view X-ray of posterior dislocation of shoulder joint, which may be misdiagnosed, so that we should go for Y view or transscapular view. Here in transscapular view, the projection is like this. Here you can see the one from coracoid process, other from acromion process, and one through the scapula. This is the Y, and here you can see head of the humerus is placed at the center of this Y. Here you can see head of the humerus is placed at the center of this Y from coracoid process, acromion process, and through the scapula. And this is a normal Y view or transscapular view. Here in posterior dislocation of shoulder joint, here you can see this green line represents normal head of the humerus. This red line is glenoid cavity, and this blue line represents posteriorly dislocated shoulder. By this Y view, it's easily we can diagnose whether there is posterior dislocation. Normal AP view, there is a chance of overlooking of the condition, so that we are taking this Y view. Another view is axillary view. This is normal axillary view of the shoulder joint. But in a dislocated condition, it's very much difficult to do. It's done in 90-degree abduction. It's very much difficult to do this particular view. This is normal axillary view. Here you can see dislocation. The better option is transscapular view or Y view. This is a special view called radial head view to check whether there is fracture to the head or neck of radius. This is open mouth view, normal open mouth view. Here you can see this is C1 lateral mass and this is dense. And if there is fracture dislocation, then you can see the lateral mass of C1 is displaced. To check this particular injury, we are taking open mouth view. This is axial view of calcaneum. Axial view of calcaneum is needed to check whether there is fracture. To check whether there is compression fracture of calcaneum, we are advising lateral view, but axial view is very important to know whether there is calcaneum fracture. This is skyline view. Skyline view is to check whether there is fracture of patella and chondromalacia of patella. These are the most commonest special views advised in X-ray prescription to diagnose fracture in OPD trauma setting. Hope you understood the video. Thank you.